Hi everybody, in this video I'm going to talk about the meniscal microstructure, and that's going to be our last topic of the meniscal basic science, and after that we will hit the road to talk about the meniscal lesions. And so let's talk more about the meniscal microstructure right now. And first thing, why so important to know more about the meniscal microstructure? And I have a simple answer for you. Because if you know the meniscal microstructure, if you understand the meniscal microstructure, especially the structure of the collagen fibers, it will be a lot easier for you to understand the patterns of meniscal tears and its repercussions, its complications, if you know that, if you know the meniscal microstructure. So let's do it right now. And first, I'd like to talk about the components of the meniscus, and we have 72% of water, 22% of collagen fibers, and less than 1% of DNA and other molecules like proteoglycans. But let's focus on the collagen fibers. In this lecture, in this video, I'm going to focus a lot on the collagen fibers. So just a quick point, a quick tip that I'm going to give here. The proportion of each constituent will vary depending on the age of the patient and also the presence of meniscal lesions. But that's the general composition of the meniscus. And meanwhile, some other studies they have shown that the composition of the collagen fibers is 75%, not 22% or something near to these numbers, because there is some variation of these numbers in the literature, but not that big difference of 22% and 75%. And which one is correct? And the answer is both. Both numbers are correct. What happens is that when the researchers they put the number 22% of collagen fibers, they talk about a hydrated meniscus, the wet weight of the meniscus. And when they use for 75%, they're talking about the dehydrated meniscus, the dry weight of the meniscus. So keep that in mind. Because sometimes it can be a little bit confusing. The literature they don't put if they are talking about the dry weight of the meniscus or the wet weight. So just keep that in mind. But let's go to the main part of our video today, that is about the collagen fibers. And I'm gonna start this part talking about the star of the play, the star of the party, the circumferential longitudinal fibers. I've already talked about that in the first video of the series. If you don't remember, go there. The first video that I talk about the load transmission, that I dissect. I had dissect a lot of things about the circumferential collagen fibers, about its functions that makes the meniscus such a unique structure. Okay, so let's continue here. Talking about the circumferential longitudinal fibers, it's responsible for dissipate the hoop stress. The circumferential fibers are located in the meniscal periphery, in the red and the red-white zone, or in the intermediate zone. They are formed by collagen fibers type 1, and these longitudinal fibers, they pass through the anterior horn to the body, to the posterior horn, and the tibial insertion occurs via anterior and posterior meniscal root ligaments. So here we have I have some points, nice points that I'd like to make to you. For example, if we have a radial tear that compromises just the inner portion of the meniscus, generally speaking, it not causes meniscal dysfunction, because the circumferential longitudinal fibers, they are located in the periphery of the meniscus. That's one point that I'd like to make to you. And the other one, it's about the meniscal root ligaments. That's why it's so harmful for the patient when the patient has a root ligament tear, because it will rupture the circumferential fibers. Okay, so let's continue, and now I want to give a zoom out, and I want to show you all the collagen structure, all the meniscal collagen structure right now. And we have 3 layers of collagen, of collagen fibers in the meniscus. The deep layer is the layer of the circumferential fibers. They are formed by collagen type 1. There is an intermediate or laminar layer formed by collagen type 1 also. These are radial fibers, not longitudinal circumferential fibers, but they are radial fibers. And we have a third layer, the superficial layer, that looks like hyaline cartilage, that is formed by collagen type 2. And this superficial layer, it's a thin meshwork of randomly oriented collagen fibers parallel to the articular surface. That it's very similar to the lamina splendens that we see on the surface of the hyaline cartilage. Okay, so let's talk a little bit more about what there are some blank areas here, and there are some structures that I haven't explained yet. So in this part, I'm going to explain for you these other structures, these other collagen fibers that are they are crucial to the circumferential fibers in order to the circumferential fibers to work properly. So I want to talk now about the tie fibers. These tie fibers here, they tie together the circumferential fibers that will give more strength for the circumferential fibers, and they also anchor the circumferential fibers or the deep layer with the intermediate or the lamellar layer right here. And continue on, they have a similar composition, the tie fibers, they have a similar composition of the intermediate layer. They are formed by radial fibers, type 1 radial fibers, okay? And now you should be asking, and what about this region here, Rodrigo? What we have here in this area? And in this area, we have cross-linked fibers. In the white zone, we have this cross-linked fibers. So in the red zone, in the red-white zone, the circumferential fibers, they predominate, type 1 fibers. In the white zone, we have these cross-linked fibers, and these are formed by collagen type 2 predominantly. And the collagen fibers are cross-linked in the white zone. The type 2, they are type 2 collagen fibers. They are smaller and less organized, more prone to tecidual fibrillation. But that's the ideal configuration for the axial load. To be transmitted and to be transformed in hoop stress. So everything has a reason, everything has a purpose here, okay? So here we have the collagen fibers of the white zone. And now I just want to make a point here and show you that at the periphery of the meniscus, the type 1 collagen fibers predominates 80%. And in the inner portion of the meniscus, the type 2 predominate about 60%, and the type 1 it's about 40%. Now, I'd like to talk about another group of molecules, just briefly about the proteoglycans. And while the collagen fibers are specialized in supporting tension forces, the proteoglycans help to support compression forces. So it's not surprising that they are located where the meniscus looks like chondral tissue and where the meniscus has to support these compression forces, the internal third or the inner third of the meniscus and the meniscal surfaces. So here we have the main areas where we have the proteoglycans, okay? And the periphery of the meniscus is more fibrocartilaginous, and there's the amount of proteoglycans it's lower in this region right here. To wrap up this video, I'd like to emphasize these points here. The central region of the meniscus is more cartilaginous and viscoelastic to absorb the axial load. The radial tie fibers, they bond the circumferential fibers and have to deal with compression in sharing forces. And these tie fibers, they are the target of the horizontal and vertical tears. And the meniscal periphery works as a ligamentous structure to deal with the hoop stress, and it is the target of the radial tears. But we are going to talk more about each of these tears in the next videos, okay? And now that all the pieces are in place, we can start talking about the meniscal lesions in the next videos. And here are some of the fantastic papers that I used in this video to talk to you more about the meniscal microstructure. So that's it for this video. I hope you enjoy it. I hope you have learned something new, or at least revealed something that you didn't remember. But thank you for your time. Have a great day, and until next video.